Something that I think maybe sometimes gets overlooked when discussing, its role as an add-on is the other elements of care, diet and exercise. I think sometimes broadly gets a brush over treatment when we're talking about it in these trials. But obviously, generally speaking, that makes up about a third of the health plan for these patients. How critical is a sincere regimen to that and a physician's enforcement of that when using these therapies for risk reduction and just overall treatment?
Critical point, because as I mentioned, there are 30 million Americans living with type 2 diabetes, and of course, not everyone is appropriate for these therapies, and applying them very broadly may have important cost implications and health system implications. As a adjunct to all health plans, rigorous diet, lifestyle, and exercise programs are critically important because in addition to cardiovascular risk reduction, decreasing the progression of obesity and obesity-related comorbidities are critically important because these have broad implications to health beyond the heart alone. And so, in all our patients, we recommend this combination: get on therapies that are able to and have been established to reduce cardiovascular risk. In addition, improve lifestyle habits, diet, exercise profile.
We still have hope to be discussing these at meetings this year. We still got ADA, ESC, HFSA, AHA off the top of my head. I'm sure there's another half dozen more meetings that we're going to be having these discussions with good hope in person. What do you hope those discussions are circled on? You said that, we're hoping to, barring the current pandemic, we're hoping to get new results for some of these inhibitors later this year, dapagliflozin, I think you mentioned, right? So what are you hoping the discussion is centered around in terms of these findings?
As I mentioned, 2019 was really defined by two really profound trials. One was Credence, and one was DAPA heart failure trial. 2020, I suspect, will be defined by a trial called Emperor Reduced. This is a trial of empagliflozin in patients with heart failure with reduced ejection fraction. It is would define if this class of therapies is important in the treatment of heart failure with reduced ejection fraction. It is investigating a slightly higher risk profile than patients randomized in the DAPA heart failure trial, and so may allow us to understand if these therapies benefit a higher risk pool of patients. That is currently slated for presentation at the ESC. However, of course, in the circumstances, that may need to be shifted. And then I think 2021 will be a fascinating year. We'll learn more about the use of SGLT-2 inhibitors in chronic kidney disease. In addition, we'll learn from two trials of both empagliflozin and dapagliflozin about the role of these therapies in heart failure with preserved ejection fraction. This is a dominant form of heart failure that we currently don't have definitive therapies for, and there's a lot of promise given the mechanisms, actions that have been posited, that these therapies may play a beneficial role in attenuating disease progression in these high-risk patients.